Hi there, welcome to our channel. My name is Sri Lekha. We at ASLPedia hope you and your loved ones are safe and well. SLPs work with many speech and language conditions, including voice, fluency, neurogenic disorders, along with dysphagia. Dysphagia is a medical condition that possesses difficulty in swallowing and is an associated complication to many other medical conditions. Hence, the role of speech language pathologists in medical setups. These professionals are designated as medical SLPs. However, in this current pandemic of COVID-19, it is important to know what exactly our course of work is. The question here is not whether we are essential workers or not, but rather if medics require our services. To speak on this topic, we have invited Mr. George Barnes, a certified speech language pathologist from New York. He will share some information regarding this.
Hi everybody. I was asked to say a quick piece on basically what our role as speech pathologists is during this crisis. I find myself in a situation where I feel like I am kind of ahead of the curve in this area, being right outside of New York City. So hopefully this won't be the case, but it seems to be that everything is hitting us first and eventually will be hitting the rest of the country in the next few days, weeks. So just a few things that I have learned. Number one, we don't want to be going into patient rooms with COVID-19 if we don't have to. We don't want to be using PPE that is and should be designated for nurses and doctors who are on the front lines and doing everything they can to save these patients' lives. We also don't want to be in and out of these rooms and dragging germs all across the hospital to other very fragile patients. So we don't want to be making this pandemic worse, basically. Some guidelines that I have learned are to do a really thorough chart review, more so than you would do before, trying to find out everything you can about the patient before you go into the room, look at the progress notes, see if the patient has a variable status, what's happening recently, look at all the other things you would look at, chest x-ray lab work, get a really good full picture of the patient. Secondly, talk to the team, talk to the nurses, talk to the doctors, and make sure that you are communicating with them and that they know that you are planning on going into that room, because sometimes it's not appropriate. Patients not, is too fragile, or is completely within functional limits. And that brings me to my last point. You see if a nursing swallow screen, a water screen, is appropriate, because the nurses are already going into the rooms. If they can do a screen, most of them are on board with that. They're already going to be in there. They don't want you using their PPE. So if that's hits, two birds with one stone, so be it. So those are just some tips that I've learned. I hope that it's helpful for you guys. If you have any questions, concerns, feedback, anything at all, please message me. I'm here to help in any way that I can, and hopefully, we'll get through this as soon as we can. All right, hang in there, guys. I'll talk to you soon.
That was Mr. Barnes, a certified speech language pathologist. There's also a short informative piece written by Mr. Barnes extensively for speech language pathologists. Please click the link in the description below to gain access. We'd like to thank Mr. Barnes for collaborating with ASLPedia and providing such invaluable and educational piece of segment. For more informative pieces from Mr. Barnes, please follow him on Instagram through the link in the description. For more informative videos from ASLPedia, please like, share and subscribe. This is Sri Lekha signing off. Stay safe.